Welcome back to Medical Monday. We are talking about lung cancer today, also cancer of the esophagus with Dr. Ninan with the Nashville Lung Surgery Center. Thank you for being here once again. We've had so many great questions from our viewers tonight. I also want to point out that you see folks, you do your surgeries at St. Thomas West, but you also have a clinic in Henry County, and that's for a very good reason. You're trying to reach out to these rural areas. Tell me about it and what you're doing and why.
So this is something that we have started approximately 7-8 months ago. And we first identified Henry County because if you look at Northwest Tennessee, there's about 10 to 12 counties there that are relatively underserved by specialists like ours. And we do have a lot of patients for heart problems, etc., that come to Nashville from that area. And traditionally, some of our pulmonologists have been going out there, etc. But there was always this feeling that patients specifically that had esophageal and lung cancer problems, especially, we needed a way to get them into the system much quicker. So we started this, what we call a lung nodule program out there, and this has been a huge success in that area. We've been extremely busy. In just 6 months, we've had, not 6 months, actually 5 months, we've had approximately 95 patient visits. And a lot of those patients have come to Nashville, had surgery and other treatments for this, etc. The second thing that we started in that we identified an 11-county area in Northwest Tennessee, and we call this this program Timeliness to Care in Lung and Esophageal Cancer, meaning what we were talking about earlier. That is that if you were found to have this, you needed to get quickly onto the specialist. We needed to do our investigating very quickly and treat you quickly.
And we're talking, we need to do it in a matter of days, not wait a couple of weeks to get to the specialist in Nashville or wherever you decide to go.
And so we spoke with all the PCPs in the area. We got them involved. We promised them that within a week to 10 days of them referring the patient, we would actually see the patient, and within the shortest possible time, we would be able to put in these investigations and get them started on treatments. Now, a lot of these treatments can be done in Henry County itself. And we use the Henry County Medical Center and also the Cancer Center there. We built a lot of relationships with the doctors there. We also started to do bronchoscopies, those scopes that we look into the lung for biopsies and things like that locally, so that the patients did not have to travel all the way to Nashville. And I think that this is where we have to go in the future, that we need to reach out to these communities and make sure as much as possible is done in these communities, but those that need the specialist treatment alone just come to places like Nashville.
It is so very important to reach out. So thank you for doing that. And it's a wonderful thing that these folks are being able to be seen so quickly, not only because it's important for treatment in these diseases, but the anxiety level that when the red flag is raised, you hear something may be wrong, let's check out your lungs. That's scary.
Yes. And so we had one patient, for example, who told us that it took her 6 weeks to get an appointment with a specialist somewhere. And this is not acceptable in today's world. The second is that we've now had multiple examples of patients in whom we have, with one visit, been able to do 2 or 3 investigative procedures so that we can get them started on treatment straight away. And that's what we want to do. We are already looking at doing this in other areas of Tennessee. And we feel that in the future, these patients will be dealt with slightly differently than they are being dealt with right now.
Well, we're talking lung cancer or esophageal cancer. Can you tell me the mortality rates that come along with those diseases?
Now, if you have stage 1 or early stage 2 lung cancer, that means that this is a tumor that is confined to the lung and has really not gone anywhere else. Then you have about a 70% chance of beating this today. And a lot of people don't know this. But once it goes beyond that, then your chances of surviving in the long term drop dramatically. So, once it goes to your lymph nodes, that 70% starts to drop to like 40% chances of surviving it. And, if it goes to distant parts of your body, it drops even further. So that is why it is critical for us to discover this early and treat people quickly before it actually spreads.
Think about your number of patients. What percentage are you seeing in stage 1 or 2?
So traditionally they have said only 15 to 20% of the patients with lung cancer actually present in stage 1.
Wow.
But with all the newer methods of detection like navigation bronchoscopies, which are advanced types of bronchoscopies, etc., we've really been successful in trying to get to see more and more patients in stage 1. And that's why it's important for us to go out there, start working with the PCPs, you know, push screening, push patients with early symptoms to get scans, to get PCPs to be able to easily refer these patients to you. So that's the way we will get more and more patients earlier and earlier. And this is very important for the nation as a whole, because the earlier we treat them, the less cost overall in their lives they're going to be to the medical system.
Absolutely. Okay, now let's switch the focus to esophageal cancer. Let's talk about mortality right there.
So esophageal cancer is overall a reasonably deadly cancer in the sense that mortality rates are quite high. However, again, the same thing holds for esophageal cancer. In early stage esophageal cancer, we know that 3 to 4 year survival rates now are approaching 70%, which was, you know, in the very early stages. But once it starts to spread outside the esophagus, then the mortality rates begin to increase and the survival begins to fall. So that's why, again, it is important for us to treat these patients early and find them early. So if you have long-standing reflux, if you have swallowing problems, if you have a strong family history of cancer and you have symptoms, you need to get to the specialist so that they can you know, investigate you and diagnose it.
All right, let's talk about treatment. What do you do for someone who you finally say, okay, you've got cancer of the esophagus, then what?
So first we'll talk about esophageal cancer, and early stage, the very early stages of esophageal cancer, that is, that just affects the lining of your lung. They even have precancerous lesions that are lesions that don't become cancer that we can find. And in those patients with precancerous lesions, we can do surgery using a scope through your mouth now without having to do an open operation to be able to remove this. So that's in the very, very early stages.
And you remove the lining that's cancerous?
Correct.
Wow.
Correct. And you know, they can be preserved their esophagus and they don't need major surgeries. This procedure is called endomucosal resections. Endo meaning you're doing it through the scope, and mucosa is the lining that you're resecting. The second group are those patients that present you with early stage esophageal cancer that are just not in the lining, that have gone just a little bit beyond that. And those patients, surgery is something that we recommend almost uniformly for those patients, unless you have a medical condition that prevents you from having surgery. But these patients, we are now starting to do more minimally invasive surgeries. We are using smaller incisions. We are using the video assisted scope. We are using the robot, and we are doing these surgeries with more and more minimally invasively. The patients that have more advanced tumors, generally we tend to send them to have some chemotherapy and radiation first, and then they come back for surgery. And those patients now we are still having to do more open operations, but the teams that we have put together, we have a program called the Nashville Esophageal Center that we have done through Nashville Lung Surgery and other groups at St. Thomas West, that we specialists who deal with these problems have gotten ourselves together as a team to be able to offer the best treatment to these patients. So when they are referred to our team, everybody participates in the decision making. Some of us share treatments in that two teams actually operate on the patient to make the operations better. We deal much better with the medical oncologists so that they treat them first, and then they know exactly what doses to give, how to treat them, when to send them to us, all these kind of things. So I would say that if you have unfortunately a diagnosis of something like esophageal cancer, getting to a specialist unit like this, that we have a lot of years of experience of dealing with this, is absolutely critical to outcome. And a lot of studies have shown this.
Yeah, many minds are better than just one mind looking at it, even if it's a great mind.
Exactly.
Collaboration.
Nobody knows everything.
Yeah, exactly. That's wonderful to hear. We only have about a minute left, but treatment of lung cancer.
Yeah.
It's a hard disease. What do you do?
And I would say that again, the same holds true. Early stages, we are able to do a lot of minimally invasive surgery nowadays. You know, we have pioneered the use of minimally invasive operations here in Tennessee. I've done that for 15 years now, and we have used the robot. You know, we did the first robotic surgery in the state, etc., so that we can offer you much more than traditional incisions.
Okay, we're going to take a quick break. We'll wrap things up when we come back. Don't go anywhere.